The NICU is full of special healthcare workers that save babies' lives every day and support their parents along the way. These heroes are not always known to the outside world. In this video, I will explain the role of each key player that is part of the NICU team that have touched and changed thousands of families' lives. Hi there, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. So it takes a special person to work in the NICU. It's not for everyone, but the NICU has special heroes that save lives every day, and they never ask for credit. Actually, most people don't even know who these healthcare workers are until you or someone you know has a baby in the NICU and you meet these healthcare workers. So in this video, I'm going to highlight and give credit to all the healthcare workers that I work with in the NICU every day. Disclaimer. So based on the country you live in, you might have different names and different tasks for all the healthcare workers I mentioned in this video. So keep that in the back of your head as you watch this video. Do not take everything I say as concrete, and instead talk with your own healthcare team if you have any question on how their team works. But most NICUs around the world have similar roles to what I'm going to mention, but they might not be exactly like I described. So let's get started. Number one, doctors. There are different types of doctors depending on their education level and their responsibility. Firstly, you have medical students. So medical students are still in medical school. They are very new to the NICU and even to the hospital setting overall, and they are being introduced to the NICU world and NICU knowledge. Residents are doctors in training, but they have finished their medical school. So now they are working on different specialties like the NICU and other pediatric specialties to see what they like and what they want to specialize in. So they stay in the NICU for a bit and then they move on to other specialties. Fellows are completing their final and extensive training to be neonatologists. So they are almost a full neo. They are pretty much independent. They have extensive knowledge of the NICU and they work closely with the neonatologist. Working in the neonatal intensive care unit is what they want to do. And then lastly, neonatologists. These are doctors that specialize in taking care of sick babies. These are the main doctors that make the final decisions, and they are leaders for the NICU teams. Secondly, nurse practitioners. Nurse practitioners are nurses who have their master's degree and they specialize in neonatal care. They diagnose and prescribe medications, and they work side by side with the neonatologist and the fellows. Charge nurses are nurses with many years of experience, and they are in charge of the whole unit. They know all the babies and all the families. They also know all the nurses and all the other healthcare professionals that work in the NICU. And we, nurses, go to them if we need extra help or have a question on what to do in a specific situation. The bedside nurse, which is what I do. Bedside nurses are registered nurses that work in the NICU. The bedside nurse works really closely with the baby and the family. They usually have 1 to 3 babies. If the baby is really sick, it'll be 1-to-1 care. Or if the babies are more like feeder growers, they can have up to 3-4 babies. The bedside nurse works really closely with the baby and their family, so we get to know the babies really well and pick up on any changes on the health of the baby. We also get to work with the family closely and help the families go through the NICU experience. We have a really good idea of what the NICU baby's journey looks like based on the gestation that they're born at. So we do a lot of teaching with parents on what they should do and how they should care for their baby to prepare them to eventually go home. We are also the main connection between the family and other healthcare professionals. If you have any questions about your baby, your nurse would be the best person to talk to. They will be able to answer your question or point you to the right direction, who might be the right person to talk to. The respiratory therapist is in charge with everything to do with breathing support and the lungs. They are there from the moment your baby is born to stabilize them, to when they come to the NICU and their NICU journey, to when they go home. When a baby is born, they are one of the main people that goes to the birth to stabilize the baby. They bring the baby to the NICU, connect them to any breathing machine that the baby needs, and respiratory therapists continue to monitor that baby throughout their whole NICU journey until they go home. If you have any questions about your baby's breathing machine, the respiratory therapist would be the best person to talk to. NICU pharmacists are specially trained to work with the smallest babies. Every medication given in the NICU is based on weight. So the pharmacist has to constantly be reviewing each baby's medication to make sure the baby is getting the right dose based on their weight. The dietitians, they focus on the weight gain and growth of our premature babies. They look at the weight over a long period of time. They look at blood work and assess if the baby is growing appropriately for their age. They also order the TPN, which is the total parenteral nutrition. And this is the nutrition the baby gets through the IV while the baby is slowly increasing their breast milk intake through the feeding tube. They also advise the medical team to start any extra vitamins or any other medications if growth is a concern. Social workers focus on how the family is coping. They also assess if the family needs any financial support, and they also take care of any insurance forms. They give vouchers for meals, buses, and taxis. Social workers also assess mental health and how parents are doing and handling everything while they're in the NICU. They give many resources to parents, such as counseling and therapy, extra mental health support. And this role actually overlaps with the next healthcare role, which is the psychologist. So many NICUs do not have a psychologist. It's actually a privilege to have a psychology working with your NICU. So the way we work with the psychologist is if we see a mother or a father not coping well, we send a referral to the psychologist, and our psychologist would actually come down to the unit and talk to the mom or dad. The psychologist usually would have a couple of sessions with the mom or dad, and she would also give many resources that they can use in the community. The thing is that many NICUs only have social workers and not psychologists, and there are actually some NICUs that don't even have a social worker. So this is just advice, that if you are in a NICU that does not have a social worker and you find that you're having a hard time coping with the NICU and you need more support with your mental health, then you need to advocate for yourself and seek out these resources. Talk with your healthcare team and talk with your nurse especially about how you can access any resource that can help you with coping. Very important, moms and dads, that you take that extra step to try to help yourself, especially if you don't have any social worker present in your NICU. Comment down below if you had a social worker or a psychologist in your NICU and you were able to get the appropriate resources you needed to help with coping and mental health. The next healthcare worker is the occupational therapist. Occupational therapist assesses baby with problems with feeding and swallowing. They also create a special feeding plan of care for parents to use and for nurses to use on how best to feed that baby. And this is all because we want to make feeding a good experience. OT also provides resources in the community to make sure babies and parents' needs are met. The lactation consultants are there at the beginning of your NICU journey to talk about exclusively pumping for your baby and how to do this. They also fit you for the proper size phalanges for your pumping kit. Also, as your baby starts to suck and wants to bottle feed and nurse, lactation consultants are great resources to help you and to teach you proper positioning for breastfeeding. They are a wealth of knowledge. You can talk to your lactation consultants all throughout your NICU. If you have any questions about anything to do with breast milk, pumping, your supply. On our unit, they're also in charge of donor milk and how much donor milk each baby is getting. The other group of healthcare workers are the front staff. So where I work, we call them the unit clerk. They do all the back end stuff. That is so important in our practice. They admit our babies in their computers, bring all the proper paperwork to us. They bring all the proper IDs for us, for the mom and the baby, and they make sure we have the right forms for all our lab work. They are literally doing everything we need on the back end. Last but not least, the unit aide. So we call them the unit aide, but these are the healthcare workers that stock up the unit. Every shift, they stock up our units to make sure we have the right supplies for whenever we need them. And when we have a new admission, they create admission packages for us, so we have everything in one place when a new baby is coming. They also help us and they grab anything that we need. Also, they make sure we have the right equipments and our equipments are working properly. So if you have any questions on who is part of your NICU team and what their rules are, then make sure you talk with your own healthcare team about this. Usually, your bedside nurse would be the best person to start with, and he or she would be able to answer your question when it comes to the NICU team and how it's set up and who's on it. Comment down below on which NICU health worker made the biggest impact on your NICU experience. And if you can't choose one, just make sure you comment down below all, because they are all amazing. Wondering what it's like being a NICU nurse that all of a sudden had her own premature baby and now her coworkers are taking care of her baby? Check out my crazy pregnancy and birth story in the next video.